Hello and welcome. I'm G. Geronimo and this is Rappler Talk. Today we'll be talking to Health Secretary Janet Garin about the recent developments concerning the Fabella Hospital. Good afternoon, Secretary.
Good afternoon, G.
Let's first talk about the first time that the move or the transfer of the Fabella Hospital was floated. When was this and what led to the decision?
Okay, let me make it clear. Fabella Hospital will not be closed. No employees will be terminated or displaced. It's not a PPP project. Well, there was a PPP proposal similar to the Philippine Orthopedic Hospital. Upon my assumption in office, I had all of those terminated. So uulitin ko, hindi po magsasara ang Fabella, wala pong empleyado ang madi-displace. At nung pagkaupo kong Secretary of Health, tiningnan ko kung advantages ba or disadvantages. So wala po kaming itinuloy na PPP project. However, sensing the history that this building is a 109-year-old building, Fabella Hospital has been in existence for 65 years because when it started occupying the building, it used to be the Bilibid prison. Okay, and because of the fact that the lot has been sold twice, the area is not safe. It was becoming very congested. Laman ng balita eh. I mean, almost every now and then, you see people complaining that it's congested, it's called a baby factory. You see mothers and babies sitting, lying down beside each other. Parang nakakahiyang sabihin na here we are in the Philippines saying that we love our women, we love our mothers and our children. At kita mong ni higaan sa panahon ng panganganak, ipinagkakait pa natin. So that was the reason why my predecessors, I think it started with the time of Secretary Duque, and then Secretary Dairit, Secretary Cabral, started to come up with the concept of what do we do with Fabella? Because the demand is increasing, the population is increasing, but you have a congested area, and the land is not ours, that's a fact. At kaya nga, linagyan siya, ginawan siya ng paraan. I think it was Secretary Duque who was able to initiate the construction of the first phase of Fabella, and then it was continued by Secretary Ona at the Lung Center compound. However, because there were management decisions of my predecessor that it will be used as a blood transfusion hospital, my predecessor decided to allow the use of the DOH compound, the San Lazaro compound, for a new Fabella building. Yes, there were proposals for a PPP, but when I took over, I realized that it was possible for the government to fund it. So I am proud to say that as I exit my office, sa paglabas ko ng aking opisina, I am very proud to say that an 800-bed capacity Fabella Hospital new building has started its construction. It's not a midnight deal. Construction started December of 2014, but since it's a 6-story building and it's quite huge with a total area, I believe, of 43,287, construction period is around 2 years. So it is expected to be done by May 2017. So hindi siya gigibain, hindi siya tatanggalin, but we are building a big new building that will be more comfortable for the mothers. It will be safe, and of course, we can call it and we can convert it into a women center.
Ma'am, bakit hindi hintayin na matapos muna yung Fabella, yung new building in the DOH compound?
We are doing that.
No, before we move, kasi di ba there will be transfer?
Okay. Yung sinasabi kasing transfer, it was not part of the plan. Kaya nga na when I source out funds for the construction, the full construction of the hospital, including its equipments, which is already incorporated in the 2017 proposed GAA, kasama na pati personnel. Kasi mas malaking hospital siya, marami tayong dinagdag na tao. We have been hiring people already. We still have 500 personnel, permanent personnel, still being hired now to man that new hospital. Bigla ang nagkaroon ng, there were 2 fires, di ba? Nagkaroon ng 2 sunog ang Fabella recently. Yung isa sa may elevator, yung isa I think sa may main building. I am not sure kung saan yung area exactly. And when it was examined, both by the Manila City Hall and of course DPWH and a private detailed engineering company called ESCA, you can probably interview them, they told us that 4 of the 8 buildings of diminished structural integrity. Ibig sabihin, pagka lumindol, eh hindi lang delikado yung buhay ng ating mga health workers, pati pasyente natin. And so the recommendation was to reduce the load. Huwag siya masyadong punuin. And since Fabella is expanding at marami na nga masyadong pasyente, hindi siya isasara, but yung overspill in excess of what is expected. We're targeting around 150 patients. Dito naman muna, for the meantime, sa lung center iha-house. Kasi sayang naman, may building doon, meron naman mga empleyadong willing magtrabaho doon, ba't hindi natin gamitin? So hindi siya isasara, magkakaroon tayo ng extension sa lung center, but we're also building a new hospital. A new building. Because as a manager of the Department of Health, I believe that we will not act when the problem is there. Dapat pinaghahandaan lahat yun. Kung alam natin hindi na magtatagal yung building, kung alam natin delikado na siya, bakit hihintayin pa natin may mangyari? And I'm very proud to say that as exit my office, kumpleto yung kanyang pondo para sa infrastructure, yung kanyang mga equipment at gamit will actually be funded by next year, and the human resource complement, all permanent positions have been funded this year.
Aside from the lung center, the building in the lung center, I heard that you will also be tapping nearby hospitals?
Sa spillover. Kasi ngayon ang ginagawa natin, pagka marami, pasok lang ng pasok, di nagdidikit-dikit na. No? And of course, when the management of Fabella approach us, it's our moral obligation to help them. Kaya pag masyadong marami na ang pasyente at nag-overflow na, we have to be honest in telling them that there are options in nearby hospitals. Kasi delikado naman, and I believe it would be unfair for the patients not to know the truth. I mean, you wouldn't like to be put in danger simply because you were not informed that the building is not safe anymore for many people. So what we were told was that we limit the patients to 150.
So how ready are those hospitals to accommodate the spillover?
Well, because the news suddenly came over, it's being done in trances. In fact, we are fast-tracking the repair of the Fabella building in the lung center compound para kahit paano pakonti-konti magamit siya. And we've tapped the other hospitals kasi meron naman na talaga silang OB-GYN ward na kung kasakaling merong pasyenteng dagdag, pwedeng i-refer sa kanila.
There are reports that where the Fabella is located right now will be used for commercial use.
That I do not know. That is best poised to the Home Guarantee Corporation. Pagdating namin sa DOH, 2 beses nang binenta yung lupa na yon. While we are fighting for it, sad to say, reality is we have a judiciary system. It's left in the courts. At kung ako naman, ano ba ang gagawin ko with 1 year in office? Will I consume my time handling cases or looking after cases? Or will I rather use my time to be able to source out funds, see to it that a new Fabella building is in place, people are there, and it is fully equipped to cater to mother and children.
You mentioned earlier that you did not agree that this be funded under a private-public partnership.
Yes.
Why is that so?
Because when I reviewed the contract, I thought it was disadvantageous to the public. Why? Dun sa PPP agreement, it was a proposal with JICA. In fact, it's funded for 100 million as a feasibility study. In that proposal, the tri-medical complex, that San Lazaro Hospital, Jose Reyes, and Fabella Hospital, ipupool mo yung iyong laboratory, yung iyong diagnostic center. When you do that, that's the bread and butter of the hospital. Doon kumikita yung hospital kasi may PhilHealth. So if you give that to the private sector, how can you make healthcare sustainable? Kasi ang ospital, kahit papano, may kita yan. Ang kita niya na ibibigay doon sa talagang walang kaya, yung hindi makabili ng gamot. Yung iba namang merong PhilHealth, marami naman ang may PhilHealth, kumikita ang hospital, it goes back as subsidy. It makes healthcare sustainable. Na kung ibibigay mo yung parte na yan sa pribadong sektor, then that hospital will have a hard time surviving because you're giving the little money that you earn, that's not even little, kasi yan yung bread and butter ng hospital. If you give that to the private sector, walang mapupunta ng hospital. It will die.
So this is a modernization project, is that
this
correct?
one that we are doing is, yes, it's a modernization project. The difference between a modernization project and a PPP is that ang modernization, pinapalaki mo, pinapaganda mo, linalagyan mo ng bagong gamit, linalagyan mo ng tao, the human resource complement. In PPP, you let the private sector invest. Once you let them invest, there's no free lunch. Siyempre, pag nag-invest yan, ang intention nila, kumita. Okay, and when they will pass that on to the patients. And that's why even for the Philippine Orthopedic Center, we disagreed because even though the contract was already signed, what was approved in the NEDA board, commensurate to the percentage of indigent or service patients, was not what was contained in the contract.
So the contract was already signed?
Yes.
You terminated it under your...
It's in the process of being terminated because it's a long process. No? Kasi may kontrata na yan, nakagastos na yung private sector. Ang mahirap kasi doon sa Philippine Orthopedic Center, well, the employees have the option to apply. Pag nag-apply sila, tanggal sila sa gobyerno, pribadong sektor na sila. So that's that's tantamount to almost privatization. And then the patient matrix na dapat ito yung service case at indigent case, ang naiwan na lang 10%. So pagka meron kang window of 90% pay patient, including PhilHealth co-pay patient, private hospital na yan. That's why we were against it.
So all the private-public partnerships that involves hospitals, those were all canceled? Is that
When I came in,
correct?
yes.
Okay.
But we didn't make a big fuss about it. Kasi sa pananaw ko naman, ang importante, gumagalaw ako, nagtatrabaho ako, hindi na lalabas ako ng lalabas at sasabihin ko, ito ang ginawa namin. Kasi kulang na sa oras eh. I only had 1 year and 4 months in office. So I was trying to maximize my office, leaving a legacy and allowing my innovations to put systems and processes inside the department.
But those who oppose this transfer of the Fabella Hospital still believe that this modernization is privatization. They worry about expensive healthcare under this transfer.
I can assure them it's not.
Are these fears valid or?
It's not valid. Wala po talagang pinanggagalingan yon. Yan nga that's actually the very sad part on us. Yan nga yung pinakamasakit para sa aming mga nagtatrabaho lamang, na ginawan mo na nga ng paraan, you prepared everything, hinanapan mo na ng pondo sa gobyerno, pinaglaban mo, sinisimulang itayo since December 2014, pinalagyan mo na ng mga plantilla position, may sweldo na yung mga taong darating, you prepared it because of course, it's the mother and child hospital of the Philippines. Pero wala kang ibang makukuha kundi twisting information and sowing misinformation among the people. We've talked to the people several times. Unfortunately, yung doon kasi sa mga nagrereklamo at nagbibigay ng maling impormasyon, almost all of them are not employees of Fabella Hospital. Yan naman po ang sad part, no? We understand that there is also a community outside that we have to take care. Yan, we can discuss that with the social welfare. I can make that part of my transition report. My successor is also very much qualified, can actually deal with the social welfare's office para yung mga bahay sa mga tabi, ng mga tindahan, yung mga nagdadrive ng tricycle, hindi mawala ng hanap buhay. Yeah, but besides for us to say, hindi naman pwedeng dahil merong mga gustong magbenta doon or dahil may mga tricycle doon, isasakripisyo na rin natin at ilalagay sa delikado yung buhay ng mga nanay at mga bata. It can actually be a mutually beneficial platform for both sides. But dapat yung talagang involved. No? Because the other employees na nagrarally, ang demand nila is increase in salary, yung mga ganito, that's beyond the gambit of our authority. And yung iba naman kasi, these are problems of other hospitals, hindi naman sa Fabella. So we can tackle it at a different forum.
So what are the updates right now? A few weeks ago, you held a press conference. What is happening right now at the Fabella Hospital?
We're still continuing the construction of the new big building that can accommodate 800 patients. Inaayos pa rin yung Fabella building doon sa Lung Center para yung overspill ng pasyente doon ilagay. Marami ang nagsabi na by June 9, isasara siya. We were all wondering where that date was coming from. Probably, I presumed that it might probably be because of, remember yung election ban, di ba na after June 9, pwede ka nang maglipat ng mga tao. Baka doon nang gagaling yung kanilang fear. Well, I do understand the predicament of those complaining na baka PPP ito. Naiintindihan ko, may pinanggagalingan sila, may hinuhugutan sila because it happened before. Pero I wouldn't, I wouldn't play with them and tell them that I canceled it kung hindi ko talaga kinancel. many were anxious. Paano daw pagpalit ng DOH secretary, gawin daw ulit yun, PPP daw ulit yun. I really believe in the voice of the people. So if they're properly informed, kung ginawa yung PPP ulit, I will join them in demonstrations and I will join them in questioning the move. But deep in my heart, I believe that my successor will not do that because when I started canceling PPP programs, she was with me.
Okay, so are you, kasi earlier you said that it's tantamount to privatization. So do you agree with former, previous accusations against this program that the PPP, the private partner partnership, is sort of privatization?
It depends because on the Philippine Orthopedic Center, in the guise of PPP, the contract that came out actually contained provisions which pointed to privatization. First, the social welfare officer is identified by the private private proponent. So, syempre, pag ang social welfare officer mo, galing na pribadong sektor, negosyo ang pag-uusapan. The patient matrix was shifted na kung dati-rati is 60-40, 70-30, na yung 70% is i-assure mo na indigent or PhilHealth yung point of care patient, yung PhilHealth only patient. When the contract came out, 60% of that became either PhilHealth or pwede siyang PhilHealth copay. Ibig sabihin, pribadong pasyente. And the 30% of that is pay patient. So if you total that, that's 90%. 10% ang may iwang indigent. That's a classification of a private hospital. Moreover, yung mga empleyado ng Philippine Orthopedic Center, which was more or less 1,000, walang assurance na tatanggapin sila. Pero kung tanggapin man sila, they relinquish their government posts. That is privatization. We have a lot of PPP programs na hindi naman privatization. In fact, when we cancel those and when we signified our intention to cancel those, ang una kong prinopose, because when I was still undersecretary, I've been proposing this as a PPP project, yung ambulance. Gawin natin parang Uber. So, pwedeng PPP yan. Kasi mahirap mag-maintain ng isang driver lang. Kung magkasakit, wala kang driver ng ambulance. Masiraan ka ng goma, magpapabiding ka pa. So, that can be a PPP venture.
But not hospitals.
But not direct patient care. One thing na pwedeng i-PPP is the hospital management. Oo, na para panatilihin mo yung manlinis, panatilihin mo yung megamot, hospital management, and then meron ka lang management fee na ibibigay. But not private, not giving into the private sector in terms of operating the pharmacy, operating the, let's say, the dialysis center, or the diagnostic center, yung laboratory. Kasi yun ang pinagkikitaan ng hospital. Kung ibigay mo yun sa pribadong sektor, wala ka ng pag-subsidize para dun sa mga pasyenteng kailangan mo bigyan ng libreng gamot, mga pasyenteng kailangan mong bigyan ng libreng operasyon, mga pasyenteng hindi nila kaya, papakainin mo yan. So these are the services. That's why a public hospital is an economic enterprise, but it's being given to those who need it. Parang may kita kang kaunti from PhilHealth and from copay, pero yung kita mo na yon, iibabalik mo doon sa mga nangangailangan. That's why you have a huge percentage of service beds. This was the defect in the PPP project of the modernized Philippine Orthopedic Center.
Okay. Going back to the deadline, the supposedly June 9 deadline.
We were wondering where that date came from.
So there's no
Ang inisip namin, it coincided with the COMELEC ban.
So they're not being, forced out of Fabella
No. Merong ibang mga gamit na nililinis na, yung mga hindi ginagamit, na nililipat na kasi walang laman yung bagong building.
Okay. So this is not the first time. Earlier we mentioned about the orthopedic center. But there are fears, there are concerns. What could the department have done better in preparing for the?
Well, I don't want to blame anybody, no? Kasi nung inabutan ko, meron na yung PPP na yan eh. What is important is hindi siya natuloy, walang pasyenteng na-agrabyo, walang pondo ng gobyerno na ginamit doon, at maganda, no, malinis yung ating pagka-explain doon naman sa ating private proponents so that we will not also be perceived na hindi tayo business friendly, no? Kaya minarapat natin na walang disadvantage sa kanila at sinabi nga natin na magkaiba ang na-approve, magkaiba ang nailagay sa kontrata. Now, if consulted during the time and if I was part of the decision makers, what could have been done was that prior to entering into those projects, the PPP office of the Department of Health should have been manned by career people, hindi na puro consultant na labas, para there will be accountability. Kasi pagka puro hindi career at puro outsiders, walang accountability. So kung ngayong may mga problema, sino ang mananagot? Pangalawa, it should be emphasized by the manager and as the Secretary of Health and the EXECO members that in healthcare, hindi kasi pwede na gagawin mo siyang negosyo. May konting kita to subsidize the poor. It's not a totally free social service, but somewhere, somehow, it should be subsidized.
Okay. On the part of the employees and the patients, because as you said earlier, there is misinformation. Could we have done better to prepare them, to brief them on what will actually happen?
We did. Not us, but the management of the hospital, because the management of the hospital is the one directly dealing with them. No? Paulit-ulit, kaya nga ang nahihirapan kami, kasi yung mga nagrereklamo, hindi empleyado ng hospital. They are employees of other hospitals. So that becomes a problem for us. Kasi syempre, ang kinakausap mo dito, empleyado ng Fabella Hospital. In fact, a very prestigious medical school was also joining in the demonstration. Alam namin kung saan nanggagaling yung kanilang fears. Pero ang nakita naman namin, hindi nga rin nila naiintindihan kasi huwag gibain. Paano mo gigibain yan? The National Historical Institute prohibits that. No, it's a historical building. Okay. Sinasabi naman huwag ipasara, hindi nga naman isasara. Well, that's the consequence of freedom of speech. We welcome that. But we also believe that for the sake of our mothers and for the sake of the people in the Department of Health and the Department of Budget and Management, who has been doing everything so that Fabella Hospital will not crumble in the future years, we believe it is just but appropriate for us to go out and inform the public na hindi magsasara ang Fabella, walang empleyado ang matatanggalan ng trabaho, hindi namin alam kung bakit paulit-ulit ng sinasabi, patuloy pa rin na twist or dinidistort yung informasyon. When we were assessing things, we just concluded that it's still a side effect, no? It's a consequence of pinaghuhugutan nila nung several years ago na nagkaroon na ng attempts on PPP.
So any change causes fear or worry? Is that?
Yeah. Nagkaroon kasi ng nagkaroon na before ng attempts on PPP, and yung fear nila, ako rin initially I said no, it's not privatization, it's only corporatization. Because that was the intention and that was what was approved in the NEDA board. But when I look at the contract, medyo nagkaroon ng pagbabago sa mga words, and those change in words actually led to privatization. Pinalitan yung government-sponsored PhilHealth, ginawang government-supported. And ang meaning ng government-supported is PhilHealth member. Hindi naman ibig sabihin pag PhilHealth member, indigent ka or sponsored ka.
Okay. How about assurances for the patients? Since you said Fabella is a 700-bed, it has a 700-bed capacity, pero more than that is being served. What are the assurances for our patients now that there's this?
That's why we are trying to decongest. Kasi kita naman natin punong-puno. If I can only do magic and let that new building stand immediately, I will do it. Unfortunately, we are not magicians. And we would like it to be constructed in the proper way. Kaya nga, it will not be too long. It's less than a year from now. By May 2017, the new Fabella building, fully funded by the government, without a centavo from the private sector, will be operational.
When will the transfer to the Lung Center building begin?
I think they're doing it in trances, and they're waiting for the license to operate. Kasi every time you have a new place, dapat may lisensya siya. So ini-inspect yun, may mga gamit yun, safety ng healthcare workers, safety ng pasyente.
So far, puro po mga buildings or puro equipments lang po yung...
Kasi kung wala kang equipment at hindi siya ma-inspect ng ating licensing division, wala kang lisensya. So kung wala kang lisensya, it cannot operate, it cannot accept PhilHealth.
Ma'am, how do we ensure that the transition, kasi nga, as you said earlier, we're transitioning to a new administration. How do we make sure that the transition is smooth and that there will be no worries along the way?
Well, I've started making all the transition reports immediately after election, and the office is now very clean. We've packed it. In fact, ang isa nga naming ginawa is pinalagyan ko na rin ng pondo ang bagong office of the secretary. The inconveniences and the problems I encountered, I don't want my successor to encounter those. What I can be proud of is that in the 1 year and 4 months that I've been in office, we have in place systems and processes inside the department. Full accountability has been pinpointed for specific programs. At bawat programa, pinalagyan ko ng understudy. In other words, programs are not dependent on a single person. It's within the institution. Moreover, we are proud to say that the Department of Health since last year has a very good utilization rate of funds. And if the fund of the Department of Health now is around 120 billion, I am proud to say that the approved budget for 2017 is 150 billion. That increase was because we were able to show a targeted implementation of programs na sustainable. Yung may plano ang departamento, merong ginagawa ang departamento, and what we did was that investment on infrastructure and equipments are coupled with PhilHealth packages so that universal health care will not only be available, but it will also be sustainable. And that's one of the legacies that I can leave for my successor. An organized, systematic movement within the institution and within the department with specific accountabilities for specific officials and specific offices. Moreover, the plans are already in place. We were able to jack up and defend a higher budget. Implementation na lang for 2017 ang hinihintay. We were able to achieve a full HR complement of all DOH hospitals. Hindi pa lang tapos yung hiring, pero may pondo na, meron ng plantilla item. We were able to revive the Philippine Blood Program, which was collapsed for several years. And then it's up to the level of the regional offices. We were able to give a full treatment course for rabies in our several bite centers. Kumpleto na rin yung ating gamot sa TB. Marami rin tayong gamot sa HIV. Kung dati-rati yung ating bakuna pang baby lang, we have now implemented the school-based immunization, the adolescent immunization where protection is from birth until senior years. In addition to that, we have enhanced, expanded, and put in new treatment and rehab centers for the victims of drug addiction and yung mental health na bigyan din natin ng focus. We also have improved the Bureau of Quarantine and the FDA. We have now satellite offices. Bottom line is that DOH has evolved into an institution that is not dependent on DOH alone. We partnered with civil societies and NGOs for program implementation, especially reproductive health and immunization and renal care. And then we also partnered with other government agencies because we believe that healthcare will not be appropriately delivered, it will not be successful without a full force cooperation of all other government agencies. So ngayon, we go school-based, we tap DILG.
We're getting questions from social media. One of the questions is that on National Center for Mental Health, you mentioned mental health a while ago. The question is, when will it be renovated and upgraded?
Funds has actually been given to the National Center for Mental Health. Nagkaroon lang yan ng problema kasi ang plano talaga siya ilipat because it's already congested and it's in the middle of it. Pagka kasi may mental condition, you want to be in a place na hindi maingay. Yeah, unfortunately, there were problems in the lot that was being procured, though it was already funded. And yun ang medyo naging problema ngayon. So for 2017, there is again a huge, I'm not sure if it's 200 million or 300 million for the repair of, for additional areas. The problem of the National Center for Mental Health, it's congested kasi walang mental health areas yung ating mga probinsya. So what we did now is while we are improving it, especially the living conditions of our mental care patients, binaba rin natin siya sa regional hospitals na magkaroon sila. And then this year, it's the first time that we are actually procuring a lot of antipsychotic drugs. Kasi dati-rate, iniiwan mo yung pamilya nila na bumili. Ngayon, pinadamihan na natin yun. Kung meron tayong malaking allocation for maintenance ng high blood at diabetes, dito naman sa mental care, dinagdagan din natin ng maraming pondo.
Another question that we received from social media, we want to know if the program for nurses under Nurses Deployment Program will be continued.
Yes. In fact, it will be increased. For 2017, we were successful in incorporating an increase, I think by 1/3. So meron siyang dagdag. On top of the Nurses Deployed Program, we have another program. I started that this year. We called it Public Health Assistance or Public Health Associates. It will be expanded to a huge extent by next year. These are nursing graduates who have not passed the board exams yet. The reason why we are hiring them, mabilis din kasi ang turnover ng ating nurses. These public health associates, together with the universal healthcare implementers, who are actually doctors who have not yet passed the board exams, are there to remain as to close in on the gap na mas matagal silang nag-i-stay, natutulungan natin silang pumasa, pero tumatagal din sila so that the institutional memory can be handed down from one nurse to another nurse, one doctor to another doctor.
You mentioned reproductive health care. I just want to
Yes.
zero in on that. Where are we now in our efforts on that?
I'm very happy that we have one of our former secretaries, SP Cabral, who really helped me in the creation of the National Implementation Team for RPRH, as well as the Regional Implementation Team. My directive was to focus on service delivery. Do away with advocacies can be good, but hindi na natin kailangan ang maraming seminar, maraming training, maraming lecture. Kailangan na natin serbisyo sa tao. Ang naging problema lang natin dito, one of the methods that was highly acceptable, the family planning implant, was issued a TRO by the Supreme Court. That's really very sad, because it's a disgrace to the Philippines, and it's also very disadvantageous to our mothers who have nothing in mind except to give their children a better quality of life. Ang pangalawang sampal na natanggap namin, when the Supreme Court handed down a TRO on FDA, disallowing FDA to issue licenses or CPRs, Certificate of Product Registration, for family planning commodities and devices. On top of the fact na tiniro yung pagbigay nila ng mga lisensya, tiniro din yung pag-renew ng permits. And these family planning commodities and devices are issued permit covering 3 to 5 years. So nung nagkaroon yung TRO, yung iba mag-expire na, yung iba pa-expire in 1 year, in 2 years. By 2018, even the private sector will not have access to family planning commodities and devices if that TRO will not be lifted. That is the biggest slap that we have now that actually killed the RH law.
And even the budget, that's why
They took out the budget. We were able to get that from our savings. But even if they took out the budget and told us, okay lang, hintayin na lang natin sa savings yun na kunin. But by the time that we have savings at the end of this year, yung mga binibili natin na binibid ng gobyerno, wala na rin. So nagiging mahal kasi konti na lang available.
So ano po ang ating actions for this?
Well, I believe that President-elect Duterte is a very decisive person. And I can sense in him his commitment to push for the RH law. I also believe that the Supreme Court will respect him so much so that his call for the implementation of the law will become into a reality. So ipinagdarasal po namin at naniniwala ako sa kanyang kakayahan na manawagan sa Korte Suprema to lift that TRO, because that TRO is not only an injustice to our women, it's an injustice to every Filipino family. Nang hangad lang ay magkaroon ng pagkain sa bawat hapagkainan, mga kabataan na pwedeng paaralin, at yung mga anak na kaya namang magkaroon ng buhay kagaya ng buhay ng mga anak natin.
What about, aside from the reproductive health law, what are our other efforts towards reaching the targets under the Sustainable Development Goals?
SDGs also has HIV, no? Ang sabi ng iba, nako, ba't biglang dumami ng HIV? The statistics that we have now is that one Filipino is possibly infected in every 1.5 hours. Pero ang nakita namin, maraming naging positibo kasi mas naging agresibo tayo sa free testing. Marami nang nagpapatingin, yung ating Know Your Status campaign. Like, naramdaman ko rin when you have yourself tested, nakaka-nervous yung pala talaga. But you have to show an example that knowing your status is not only best for you, but also your partner. And that campaign actually paved way not only for Metro Manila to have testing centers, but for other provinces, other cities. You have Cebu, Davao, ibang areas, Luzon, Visayas, Mindanao, dumami yung ating testing centers. In fact, one of the programs that we will be rolling out in the maybe in the next month to come as I leave office is enhancing our blood donation program. With that blood donation program, it will now be coupled and tweaked with our HIV program. So if there are blood donation mobile vans going out, it can also be an opportunity for those who would like to get tested to go into that van, have themselves tested. The results will be held confidential. And if ever positive, you will be tapped to the community of HIV patients.
But the HIV, it has been an epidemic under this administration. Were there lapses?
Because we have an accurate testing, ibig sabihin, dati, konti lang, kasi hindi naman tinitest. So even before, we have been saying it's a false negative presumption na konti ang may HIV sa atin because the lifestyle is there, the exposure is there. Ngayon, dahil marami na ang testing centers, marami na ang nagpapatest, dumami ang positibo. But what is the difference now and before? Now we have patients who will turn out positive na nai-intercept mo sila sa maagang stage. HIV positive, hindi pa full-blown AIDS dati. Nagtetest ka kasi marami ka ng sintomas at pabalik-balik ka sa hospital. Ngayon, nagtitest ka because you want to know your status. And we intercept patients at the earliest possible time. Kaya ang nangyayari, itong mga kabataan, itong mga pasyenteng ito, we get them early, we give them medications early, they have less complications, they live a happy life, and they protect their partners.
Okay, I want to go back to the change in administration, and President-elect Rodrigo Duterte already named his choice for Health Secretary, which is Assistant Secretary Pauline Ubial. Have you already talked to her after
Not
last
yet.
night?
I tried communicating, but she's in Singapore. Kasi usually when she's abroad, we communicate by email. And I texted her niece that we're ready for the turnover. Pero yun nga, babalik siya later part of this week. So I do congratulate Secretary Ubial for a position that she deserves. And we look forward to turning over many of the programs. Naniniwala naman ako na bawat tao may kanya-kanyang kakayahan na mag-manage. There can be possibly different management styles, but what is important is if your heart and if your mind and if you're committed to universal health care, everything is possible.
So what should the next Health Secretary push for? What should Assistant Secretary push for?
Lifting of the TRO by the Supreme Court, that's one. And of course, we are very proud to say that I'm giving her and leaving her in office wherein the jump in the fund utilization was huge. Programs has been implemented fully up to the grassroots level. Naramdaman ang departamento, hindi lang sa loob ng Metro Manila, hindi lang sa loob ng opisina, na disiplina namin, na pakonti namin yung trainings and seminars by coining many of the trainings and seminars. And that savings was actually transcended down to the people. Na hanggang sa barangay, nakakatanggap ng mga gamit yung ating barangay health workers. And now it has just started, but again, it's fully funded. Many of the schools, we have 5,700 schools na magkakaroon ng isang nurse plus school clinic. Yung ating immunization program, talagang napalawak natin. And we have booster doses kasi dati-rate, yung mga bakuna na para sa mayayaman, ilang taon pa before makamit ng gobyerno. What we have now is that the vaccines available for the private patients are already available for the government patients, including booster doses, including vaccines for senior citizens. That is truly universal health care. And I look forward to Secretary Pauline Ubial continuing these programs. And while we had made universal health care available, accessible, and attainable, we have started its sustainability. We look forward to her leadership in making that more sustainable. And I'm happy to say that, again, we have another woman in the cabinet. That's something that we can be proud of.
Okay. But you're stepping down on June 30. Do you
Yes.
think there were missed opportunities on your stint as health secretary?
Well, when I came into the department, there were internal problems related to procurement issues. There were problems in terms of management things inside. We had a lot of COA reports. There were a lot of red flags. And there were some cases being filed right and left. And full accountability was also not in place. So it was a roller coaster ride. And ang una akala ko hindi ko kakayanin. But what made it possible for me was that when I entered the department, I realized this is an institution where many of the doctors, directors, medical and paramedical workers, and even the admin officers, people handling finance and administration, we're all ready to help, unite as one family, and put DOH where it should be. So with 1 year and 4 months, it might not be enough kasi syempre, sandali lang. But looking back and talking with my execo members, our directors, up to the janitor, at kanina nga nung nagkakainan kami kasama yung ibang mga clerk, parang it makes you proud to say that the team was able to make a difference, and that is what matters. Even if I will be outside of the Department of Health, that will not prevent me from making recommendations, putting forward strategies that will make healthcare felt by every barangay in our community. Ang importante kasi doon is your competence should be coupled with commitment, because that competence and commitment can actually make a lot of difference. So yes, may mga kulang na konti, but then there's still life after DOH, and you can still help DOH even if you're not in that office anymore. Ang sinabi ko nga kanina, when we work for the department, all the outputs and the outcomes is not owned by the department alone. We have been successful in many instances because we had LGUs who helped us. We had volunteers, health partners, international organizations, and we had civil society who helped us. So malaking bagay yon. On June 23, we will be awarding the 20 Bayani ng Kalusugan. So these are people who had made a difference in the healthcare of our population.
Thank you for joining us today, Secretary. Thank you for talking about and the best of luck for what happens next year.
Yeah, thank you very much, G, and I look forward to working with you and probably going back to school, learning more, because whenever you learn something, you become a better contributor to society. Maraming salamat.
Thank you, ma'am. We've been talking to Health Secretary Janet Garin about the Health Department's plans for the Fabella Hospital and what's next for healthcare in the Philippines. This is G. Geronimo, and thank you for joining us.